When a child needs to undergo a medical test or procedure that requires them to stay still or motionless for any period of time, it is normal to give them sedation to keep them still and to reduce anxiety that they might feel during the procedure. An example is if a child needs a magnetic resonance imaging test or an MRI. It could require the child to lay perfectly still over the course of an hour in about 10-minute increments while being surrounded by a large machine that makes noises and that at times can be very, very loud. This would probably be very uncomfortable for the child and difficult to accomplish the test. Often, the situation may not allow a parent or guardian to be present in the same room, and at times the child could even be alone in the room during a procedure, another situation that may cause the child stress and anxiety. Sedation is a process of giving a child medication that keeps them comfortable and sometimes puts them into a deep sleep so that they will not feel pain or remember anything about the procedure when it is finished. The medical team working with your child will be devoted to keeping your child safe and will make sure your child will not be in any pain during the procedure. The team includes a doctor and a nurse trained specifically to work with children and young people. The doctor may be a pediatric intensivist who has special training just for sedation. Your child's care team will be present before, during, and after the procedure. When you and your child come in for your appointment, the team members will ask you both if you have any questions. Sometimes, the child will change from their clothes into a hospital gown. When the procedure begins, your child will be connected to the monitors that will measure their heart rate and blood pressure. A small device called a pulse oximeter will be put on your child's finger or toe to measure the amount of oxygen in their blood. An intravenous catheter, often called an IV, will be placed into a vein, usually in your child's arm. A needle will be used to place the IV, but it will be removed once the IV is in, leaving the IV in place. The IV will be attached to a tube and will stay in place throughout your child's procedure. The sedation medication will be given through this IV. This can be the scariest part of the procedure for both the child and the parent. If your child has never had an IV placed before, please explain this procedure with them ahead of time so that it does not come as a surprise when it is done. Once the sedation medication is started, the medication will generally have them asleep within a minute or two. As their parent or guardian, your child will look to you to explain what is happening and for reassurance. We encourage you to discuss the procedure in detail with your child's doctor so that you can understand what is taking place and why. This will allow you to explain the procedure to your child and help them to feel more comfortable with the situation. Remember to be honest with your child. Make sure that they understand what is going to happen and why. Take time to speak with your child well before the procedure begins. Give them plenty of time to ask questions. For younger kids, be sure to use simple and clear language that you know they will understand. If you feel comfortable explaining the procedure to your child, it will help them to be less anxious. If you don't know the answer to one of their questions, tell them you will ask the doctor for the answer. If you seem nervous or unsure, your child may pick up on that, and they might feel nervous as well. The doctor and care team will always be happy to answer any questions. Now, let's talk about how you and your child will prepare for this procedure. Before the day of the procedure, take some time to write down important information that you will need to give to the medical team when you arrive. Please list any health conditions that your child might have, such as asthma, a recent bout of pneumonia, or other diagnoses like diabetes. Write down any allergies your child might have, perhaps to medicines, foods, or materials such as latex. Include if your child or anyone else in your family has had an allergic reaction to any medications, or to sedation or anesthesia. List any colds or flu, or if your child is just getting over an illness, or has recently been close to someone else who has been sick. Make a list of all medications your child is taking, the amount they take, and how often they take them. Include all prescription drugs, any medicines you buy for them over the counter or online, vitamins, supplements, or herbal products. Be sure to give this list to the medical staff the day of the procedure. It is very important that your child's stomach be empty for any sedation procedure. If there is food in their stomach, your child can throw up and the food can enter the lungs, and this can be very dangerous. If for some reason your child has eaten something too close to the procedure appointment time, it will be best to simply make another appointment rather than risk these complications. We understand that accidents can happen, so just let us know if your child has eaten before coming into the appointment. Here are some of the specifics about limiting food and drinks before the procedure. Stop all meals before the procedure. If necessary, a child can eat plain toast or cereal up until 6 hours before the procedure. Stop drinking milk, infant formula, and most other liquids 6 hours before the appointment. Stop breast milk 4 hours before the procedure. Stop all clear liquids, which include apple juice and water, 2 hours before coming in. No gum or candy can be allowed within 2 hours before the procedure. Before coming to the appointment, ask your child if they would like to bring something with them to have during the procedure time. Some kids may want a favorite toy or blanket. Having familiar items with them can help your child to feel more comfortable before and after the procedure. Older children may want to have a portable music or game player. On the day of the procedure appointment, your child must be accompanied by a parent or legal guardian who can sign the consent forms. This is really important because written consent can only be given by a parent or legally named guardian, or the procedure will be rescheduled or canceled. If the procedure is scheduled for a time when you cannot be there in person, we can reschedule the appointment for a time when you can be. Or we can check to see if you can sign the forms ahead of time. Once you have arrived for the appointment and your child has been prepared for the procedure, the sedation will be administered as we described earlier in this presentation. When the sedation medication is given, it usually takes less than a minute or so for kids to fall asleep. They will not wake up until after the procedure has been completed. Remember, you may not be able to be present for this process. If your child has brought a toy or blanket with them, they can hold it until the sedation is administered and they will be asleep before it is removed. The sedation team will watch your child continuously to make sure that they are comfortable and safe. When the procedure is finished, your child will probably wake up in a recovery area. If they brought a toy or blanket, it will be returned to them when they wake up. We encourage you to be present with your child during this time. The nurse will continue to closely monitor them while the sedation wears off. Children wake up from sedation in different ways. Most children return to normal quickly. Others may wake up more slowly. It usually depends on the child. Sometimes kids wake up feeling confused, scared, or angry. Please feel free to ask the nurse or sedation team any questions you have while your child recovers. The IV may not be removed until shortly before your child is ready to leave. The benefits of sedation are that it will help your child to be comfortable and free of pain during the procedures. Some procedures cannot be done unless the patient can remain totally still. As with any medical procedure, there are some risks to using sedation, and we want to make sure that we have answered all of your questions so that you will feel confident about your child's procedures and safety. The main risk for procedural sedation is respiratory compromise, or trouble with your child's breathing. If the child has difficulty breathing on their own, the care team may need to use techniques to help them to breathe until they can breathe on their own. In rare cases, this could require the use of a ventilator or a breathing machine, and this condition can be life-threatening. Some other risks that occur rarely include possible lung infection like pneumonia or other breathing problems. There is a small risk of a bad allergic reaction to the medications used. In extremely rare cases, a reaction could also be life-threatening. Usually, there are no side effects from the use of sedation or anesthesia medications. Some side effects that are common for children recovering from sedation include feeling sick to their stomach or nauseous. They might throw up or feel chills or have shaking or dizziness. If any of these experiences occur, your child's care team will do everything they can to make sure your child is as comfortable as possible. If your child's procedure is done on an outpatient basis, they will be able to go home as soon as the care team decides it is okay for them to be discharged. Some recovery periods can take a little longer than others, and the team wants to make sure everything is all right before you leave the medical center. Once you are home, if your child has any problems which you think might be related to the sedation, please refer to the discharge instructions for the way to proceed. Please remember that your child's sedation team is trained to keep children safe and pain-free during the medical procedures. If you have any questions at any time, please be sure to ask, because the more you know, the more control you will have, and the safer your child will feel.